This is No Spin Live, and today we're going to talk about Rodrigo Alves, not a stranger topic on No Spin Live, who's had hundreds of procedures, but apparently he's had 60 surgical procedures, and he just had some ribs removed. I think that was number 60 or 61. He says, that's it, fini, no more surgery. We actually have not had Rodrigo on this show, but we've had his girlfriend, Pixie Fox, and Rodrigo is actually recovering from another surgery when we had her on. But what do you think about this? I can't imagine this is going to be his last surgery, just given the history.
I agree with you. I think I've met Rodrigo several times. He wanted me to do surgery on him. I think this is a classic problem of the patient with some type of leverage pushing the plastic surgeon to operate. If you think about Michael Jackson pushed his plastic surgeon, who most of us know, to do multiple surgeries too soon, and we know what happened there. And I think with this, it's a little different, where you have the slightly famous, Insta-famous person requesting surgery, and the surgeon can't resist. And the difference is it's not the same surgeon every time. It's one of 60 different surgeons. So each of them feels like maybe they could get some marketing out of it or whatnot. So there's kind of abuse on both sides in this kind of scenario. And I think it's unfortunate because Rodrigo, there are certain things he should just not be having this much surgery. No person should. And I think, the problem is there's always someone willing to do it.
What's your read on Rodrigo, Sean?
I completely agree with Dan. I'm concerned about all these doctors that are actually doing these procedures. I think they're just almost as fault as him. I've never met the man, but he clearly has some level of body dysmorphia. And then he really has sort of an inappropriate relationship with plastic surgery. Like he paralleling it with career advancement, things like that. These are all things that we're taught to tell our patients that these things aren't associated with that. You should be doing surgery because you have a particular issue that you want to be treated. And lastly, he just has an aesthetic that I just don't really share.
So Dr. Maman, don't you think there's got to be some relationship between the number of surgeries you've had, and then it's almost like once you had a certain number of surgeries, you're going to be having more surgery because it's just in the maintenance of just all the surgeries, don't you think?
I was going to make the exact point. I think it's with near 100% certainty, it's inevitable that he has future procedures just based on potential complications that are going to occur from the amount of surgery he's had to date without knowing the exact procedures he's had. I mean, it's like, if you put in breast implants in a 22-year-old patient, I mean, you can almost guarantee her that over the course of her lifetime, she's going to have at least one or two operations for revisional surgery, either implant replacement or some type of skin operation down the road. And the same is true for him.
I don't have any patients quite like Rodrigo in my practice, but on the filler side of things, we all have patients that push us and you're like, no, you're cut off, no more. And they're like, oh, please, a little bit more. So they're starting to look like Rodrigo over time. And then I see him, I go, you're cut off for 6 months, you got to come down. So I think it's something that happens to all of us, maybe not in the extreme as with Rodrigo, but we all have to kind of cut patients off sometimes and say, okay, enough is enough. You're not helping yourself or my practice with doing this.
This won't be the last time we talk about Rodrigo. We need to have him on because he's definitely a person of interest for plastic surgery. So maybe we'll do a no spin and we'll all get together and we can just hear how Rodrigo talk about it. But anyway, I'm sure that you've enjoyed all these insights from our experts. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.